Hi, everyone. Welcome back to Mad Barn Academy. And if you're new here, then welcome. We hope to earn your subscription today. I'm Dr. Fran Rowe, one of the veterinary nutritionists here at Mad Barn. And today's video is part 2 of osteoarthritis. So we'll be focusing today on diagnosis and management of OA. If you haven't seen the part 1 video for this little 2-part series on osteoarthritis, I recommend that you go ahead and do that now. I've included a link to that video in the description below. It'll give you some necessary background on the pathology of osteoarthritis, which definitely informs our management decisions. So you'll have a better understanding of why we undertake, certain management options, which we'll be discussing today. Okay, let's get started. All right, so we left off that part 1 video with this concept that osteoarthritis is really a cycle of degeneration that feeds into itself. So these degenerative changes, once they start in the joint, are going to incite inflammation, and that's going to lead to even more degenerative change, which will lead to more inflammation, and so on and so on. So when we talk about treatment or management strategies, we'll be looking to target these two big categories: degenerative change on the one hand and inflammation on the other. But first, let's quickly talk about how osteoarthritis is actually diagnosed. So in many cases, we can diagnose OA based on the horse's history, their physical exam, and a lameness exam. And that'll be called kind of a presumptive diagnosis. Response to therapy can also be helpful in supporting our presumptive diagnosis, because if the horse responds favorably to our therapy, then we'll feel more confident that we're actually targeting the right thing. Nonetheless, many times it's helpful to get some extra information with diagnostic imaging. So in the farm setting, your vet is most likely going to be able to perform radiographs or ultrasound. And getting an kind of inside look, really aids in diagnosis, but it's also going to help to characterize the extent of degenerative change in that particular joint. And it gives you a starting point to kind of track those changes over time. And that latter point might be really important for the performance horse, especially if that horse has sale potential in the future. So advanced imaging like our MRI, CT, or nuclear scintigraphy or bone scan could be necessary if the suspect location of arthritis is inaccessible or really difficult to image with routine radiographs or ultrasound, say in a location like the hip or the shoulder. So in this radiograph image here, this is a radiograph of a hawk, and the arrow is pointing to arthritic changes in the distal intertarsal joint, or the DIT. All of that kind of fuzziness that you see, it really shouldn't be there. So it should be this nice, clean, straight line through the joint space, just like that joint right below it is a nice, clean, straight line. All of that fuzziness is indicative of bony change and bony remodeling. It's really important to realize that osteoarthritis is a manageable condition, but it doesn't have a definitive cure. We can certainly slow down disease progression. We can improve the horse's comfort. We can promote repair in the joint, but we really can't reverse the changes that have already happened and go back to a normal joint. So our two big targets, which we already talked about, are going to be reducing inflammation in the joint and then promoting repair in order to kind of combat some of those degenerative changes in that affected joint or joints. So some of our strategies that we'll talk about kind of overlap in these two departments. So let's go ahead and kind of walk through what some of our options are. When it comes to targeting inflammation in an arthritic joint, we can either take the approach of a non-specific anti-inflammatory that's going to kind of target the whole body. such as with systemic anti-inflammatories like Bute or Equiox, or we can take a more direct approach by actually administering that medication, that anti-inflammatory medication, directly into the affected joint. And that would be via intra-articular or IA injections of most often steroids into the joint, but there are other substances that can be injected into the joint for this purpose. So systemic anti-inflammatories, systemic just meaning whole body, would be given every day. And this is kind of our non-specific approach. When we take an ibuprofen or we take an Advil, you know, it's gonna provide anti-inflammatory support throughout the body. Same thing with the horse. So this strategy is really going to kind of target multiple joints versus our joint injections, you know, are going to be more performed on an as needed basis. Generally, that might be every 6 months, maybe every 12 months. It will certainly depend on the horse and the degree of arthritis in that particular joint. But this is a really targeted approach that's specific to the affected joint and then leaves all the other joints as is. In addition to trying to interrupt the inflammatory cycle in the joint, we can also aim to provide the body with building blocks that help facilitate the natural healing processes within the joint. One of the most common ways to do this is via administration of a chondroprotectant. So a chondroprotectant is just a fancy name for any type of substance or medication that supports joint cartilage health. Some of the chondroprotectants you guys might be most familiar with are hyaluronic acid, or HA, and glycosaminoglycans like Adequan or Zycosan or Pentosan. So HA can be given orally in an oral supplement. It can be given IV in the vein, which would be Legend. It can also be combined with steroids and injected directly into a joint, which is also very commonly done. On the other hand, Adequan and Zycosan are most often given intramuscularly in the neck muscle. There is a formulation of Adequan that is available for injection into a joint. So another avenue that is becoming more popular and more accessible to both owners and veterinarians in the field is regenerative medicine. So as the name implies, regenerative medicine supplies the body with mediators and beneficial factors that promote the regeneration or healing of damaged tissues. Now, you might recognize a few of these acronyms here on the screen. There's PRP, or platelet-rich plasma, IRAP, or interleukin-1 receptor antagonist protein, and Prostride, or autologous protein solution. So these regenerative therapies are considered autologous, meaning that they are derived from the horse's own body. For PRP, IRAP, and Prostride, these solutions are derived from the horse's blood. So once that blood is drawn, it's going to be processed through a special kit that is going to isolate what I like to call the good stuff. So these anti-inflammatory mediators, growth factors, specific proteins, etc., that are all naturally circulating in the bloodstream all the time. They're just circulating in very small amounts. So the special processing helps to concentrate these factors into a much smaller volume, which can then be injected back into a joint. So stem cell therapy is a touch different in that stem cells are going to be harvested from the bone marrow. In horses, the most common locations for for stem cell harvest are going to be the sternum and then the pelvis. So then the process looks a bit similar. That tissue sample is going to be processed in a special kit designed for stem cell isolation. And then once those stem cells are concentrated and ready to go, they can be injected back into a particular site of interest. So just like our other joint injections we just talked about on the previous slide, these type of injections would be performed on an as-needed basis. These types of therapies are becoming more popular because they offer both the anti-inflammatory component that's really important, as well as this tissue repair component for managing osteoarthritis. They're also a really great option to consider for horses that cannot tolerate steroids with traditional joint injections. Last on our list for providing kind of direct joint support or whole body joint support is through the use of nutraceuticals or nutritional supplements. So there are a lot of different joint supplements on the market. Of course, when you go to Google, you're going to see many different types of products that have, different ingredients or a combination of ingredients. And that can be really overwhelming because it's hard to know what to choose. My recommendation is to really focus on the products or the ingredients in those products that are backed by the most scientific evidence or supporting evidence and research. So the two that we like to recommend most often are a DHA, which is an omega-3 fatty acid that has anti-inflammatory benefits, and then MSM, which has been around for a really long time, but it's an antioxidant that supports the regulation of inflammation and really promotes joint health. There's also some really promising early research for resveratrol, green-lipped mussel, avocado, or soybean unsaponifiables. So you can definitely keep an eye out for products that include those ingredients in their formulation. Certainly, it wouldn't hurt to provide. Now, you might be wondering about kind of the two big names that you often see in joint supplements, glucosamine or chondroitin sulfate. These are really commonly included in joint supplement formulations, but research has really demonstrated that they have poor oral bioavailability. So the big question is, even if we're providing them orally, are they actually doing anything if they're not being absorbed out of the gut? Last but not least for today are a couple additional considerations, which are really centered around how we can reduce that wear and tear on the joints in order to slow down osteoarthritis progression. So first is modifying workload. Think about ways that you can potentially modify your horse's workload to better support their joint health. That might mean minimizing days of strenuous exercise, like schooling over jumps or running your barrel pattern, etc., particularly for seasoned horses that already know their job. Additionally, this is particularly important for our young horses, but following an age-appropriate exercise program. And then lastly, avoiding, difficult terrain, excessive lunging, or some of these other activities that may accelerate and or exacerbate osteoarthritis. It's also really important to remember that body condition is a key factor in supporting joint health. So excess body weight adds a lot of stress and a lot of strain on joints. So for horses with osteoarthritis, it's recommended to maintain them at a lean to ideal body condition. So that 4 out of 9 or 5 out of 9 on the Henneke scale. Okay, you guys, here are references for today. And thanks so much for listening. Be sure to check out the additional links I've provided in the description below if you're interested in learning more about our management strategies for arthritis, joint injections as an option for arthritis, and certainly some extra research behind some of our joint supplements. Also, don't forget to like and subscribe to our channel. Explore the other videos on our channel. We have new stuff coming out all the time. All right, be sure to check back soon. Until next time.